Hi, this is a quick walkthrough of the Health Guide Lab. Just to explain what you need to do. This is your book. This is the part of the book that has the diagnostic keys. And if you open to the page just before the keys start, there is an index of a whole bunch of different symptoms that tells you which page to go to in order to start hunting down your particular disease. You've got your basic sheet. It's got part 1. You've got another sheet. These are the synopses you're going to use for part 1. You have part 2. Part 2, you need a partner for. You need to grab somebody who's willing to do this and pick 2 of the 6 options. You've got 6 options listed in the file. And if they do it right, this is going to be fun, is that they open it, they look at it, and they play the role for you. Now, they don't know what they have. You know, this is like as close to a real world situation as we can get. So they play the role for you, and then you answer the same questions you would have answered anyway, except for the beginning, where it asks which role they're playing. Other than that, I'll walk you through this. Okay, just kind of randomly. I'm going to pick number 7 of these, because it can be a little tricky, so this way I'll get you through one of the tricky ones. You're going to answer these questions for each one of these. So this one for part 1, what's the title of the synopsis? I don't want number 7, I want another bad breathing day, so that it's for me. It's easier for me to correct it if I see the title and I remember what it is. But that's simple enough. Another bad breathing day. You've answered question 1. Number 2, which particular symptom are you going to be focusing on? And for that, you have to read the synopsis. So I'm going to read it. You're wheezing again after climbing the 2 flights of stairs to your dentist's office. It's become quite a problem lately, especially since the weather got dry. You don't seem to have a cold, even though the wheezing often leads to coughing and some nasty phlegm. Could it be your smoking? Maybe your job, you work in an auto body shop. It doesn't seem to be getting better. So, the next question, what symptom are you focusing on? Well, this is where the book index becomes fun. You may go wheezing. Okay, wheezing sends you to page 271. You may go coughing. Coughing sent you to page 268. So I want to know which symptom you're going to use. Let's see. Breathing difficulty sent you to 272. Those are all potential starting points for you to go into the book and into the symptoms. I'm gonna go with wheezing, just to give me something to go with. So I'm going to go to page 271. And so if you want to check along with me, go to page 271. And it's a flow chart. It's a lot of, if you answer yes, you go one way. If you answer no, you go another way. And hopefully it gets you to an actual condition. If it goes, just go see a doctor, you went the wrong way. It always should get you to at least one condition, sometimes more than one. So, did you begin wheezing within the past few hours? Well, the synopsis says this has been happening for a few days. So the answer is no. Is your temperature 100 degrees Fahrenheit or higher? Don't add things that aren't in your synopsis. There's nothing in your synopsis about having a fever or feeling warm. Do you wheeze on most days? Quite a problem lately, so it sounds like you wheeze on most days. Do you cough up gray or greenish yellow phlegm on most days? Well, it talks about the nasty phlegm, so that's probably a yes. And then it goes, so see your doctor. You may have a lung disease such as chronic bronchitis or emphysema. So it gives you two possibilities. And that's your next question is, well, no, your next question is what's the title on the chart you're going to use? And in this case, it's wheezing. Because sometimes the symptom you pick doesn't actually match the title of the chart. So a lot of times it'll be the same word, but not always. What does the guide suggest the problem is? Well, the guide suggests chronic bronchitis or emphysema. So right now, we're going with both of them. Follow up, go to the suggested page. What's the actual cause of this problem? So this on page 655 and 656. I'm just flipping through here. And I've already forgotten. This is why you write stuff down. Chronic bronchitis and emphysema. Okay, so chronic bronchitis starts on the bottom of page 655. And now we're looking for a cause. So I'm just glancing through here. This again, training you to be able to scan for information. Cigarette smoke is usually the cause. It mentions that you're a smoker. People who live near or in industrial or polluted areas, it talks about your job, and so pollution there. Sometimes a complication of cystic fibrosis, that doesn't seem to fit here. Now, I'm fine with you writing down everything, but I'm also fine with you going through and just picking out the stuff that seems to fit your particular setup, so that you're not writing and writing and writing and writing. Okay, I'm continuing. Then it talks about how you don't have to get into all the stuff about mucus and cilia and stuff. Now, emphysema is cigarette smoking is almost always the cause. Pollution can be a problem. Doesn't really talk that much about the phlegm. So the next question is, it does look like it's connected to smoking and probably the air in the auto body shop. And then question 6, and this is important. We have two possibilities here that we put both of them down, but we want to make sure that one of them isn't maybe better than the other. So I'm going to look at the symptoms. Chronic bronchitis is a cough that brings up phlegm, wheezes through the day, progressively more breathless, and a gradual decline in their abilities to tolerate exercise. Climbing the stairs. Sometimes they look blue in the face and never mention that. They may eventually have respiratory failure. We're not there yet. Emphysema. Shortness of breath at first occurs only during exercise or strenuous activity. This one says you're wheezing again after climbing the stairs. That is suggesting that the exercise may have started it. Person's chest may become barrel-shaped. Oh, you may cough up phlegm if you also have chronic bronchitis. So the chronic bronchitis is connected to the phlegm, the emphysema is not. So the next question is, are you sure what you got? And if I was doing this and I'm doing this with you, I'd go, I think it's chronic bronchitis because of the phlegm. It might be the two of them together, but the phlegm connects it to chronic bronchitis. And that's good. And then, now the book used to have a little section that actually had risks, but talks about complications. But this now integrates the complications into it. May eventually experience respiratory failure is kind of a risk. And so that's your next question. How is it usually diagnosed? There's a whole section in every one of these conditions about diagnosis. So tell me how it's diagnosed and tell me how it's treated. So the book kind of breaks everything down for you to answer these questions. When you do part 2, your partner is going to have a little description, and there's going to be 2 parts to it. There's going to be a description of the role that they're going to play. Remember, they don't know what they have, but they know how they're supposed to portray it. And then there's a little thing that says what you can reveal, or I forget exactly what it says, what you can tell your partner. And that's what they can tell you before they start, because in some cases they're playing the part of like a toddler. And so they should tell you, I'm going to try as best I can to respond as a toddler. So if you ask me a really complicated question, I'm just going to go, and just so that there's no weird stuff involved. If it involves something where you need to poke me, just point, and we'll assume that you poked me. And sometimes they'll go, I can't tell you anything. Just when you're ready, I'll go, and we'll get into this. And it can be interesting to do. Unfortunately, the book used to have an area with schizophrenia, and we used to have a performance for schizophrenia. People would really get into that. It was really hard to diagnose them. And so you're going to answer the same questions, except you've got to wait until you've kind of worked through the performance before you even have a guess at what symptom you're going to start with. But other than that, you can just, once you're into the flow chart, you can keep asking your partner questions and see what you get as answers to work your way down through the flow chart to a possible answer. And keep in mind, they don't know what the answer is. Okay, that's the breakdown for the Health Guide Lab.